I am a lifelong resident of Almaquee County. If there's an incident where someone is injured or struck with an illness, the community rallies around that family and just does everything they can to support them. We just really do care. I'm a nurse. I've been a nurse for over 30 years. I've worked in the hospital and acute care setting, worked in the surgery unit, worked in the obstetric labor and delivery unit, worked in the emergency room, and I've also worked in public health. When we talk about healthcare, you never know when you're going to need it, and no matter how healthy an individual is, the likelihood that they're going to need some type of healthcare at some point in their life is very high. The cost of that care has become astronomical. The average family has a hard time paying their monthly premiums, much less being able to access the preventative healthcare that they need or just the healthcare that they need. And people are tolerating a lot just to avoid the additional costs that they feel that they can't afford. With the privatization of Medicaid, we had to be more conscientious about our billing, and it limited the amount of revenue that we were generating. So ultimately, the board of directors had to take a look at that and made the very difficult decision to then close the clinic. We want Iowa residents to be healthy, bottom line. I've cared about the well-being and the success of people who live in my district. I think that's really important, that they have access to the services that they need, and they have access to quality healthcare locally. All of those things that impact people's lives on a day-to-day basis and help them move forward to be successful people in our society. Des Moines has forgotten what it's like to live in rural Iowa. I think they've forgotten what people in rural Iowa truly need and expect from their government representatives. I've got over 30 years of experience and have seen how our healthcare system has changed. I'm willing to listen and hopefully make decisions that are going to be the best impact for the people living in my district and living in the rest of Iowa. Let's work on making things better in our state. I'm Lori Egan, and I'm running for Iowa House District 56.